Hi, today we are going to learn about avulsion tooth. Avulsion is a complete dislodgement of a tooth out of its socket by traumatic injury. Short extraoral dry time and the proper storage media are the key factors in offering favorable treatment outcome. Avulsion is a complete dislodgement of a tooth out of its socket by traumatic injury. Extra alveolar dry time, that is EADT, is equal to amount of time a tooth has been out of the mouth while dry. Avulsion treatment is re-implant as soon as possible. Flexible splint for 1 to 2 weeks only for permanent tooth. For deciduous teeth, we should not do splinting because it damages the permanent tooth germ. Factors to manage the traumatic tooth are the time, storage media, tooth socket, root surface, and splint stabilization. There are 5 factors that is to manage the traumatic tooth. What is meant by time? The time important factors are periodontal ligament should be a viability 30 minutes. Very little resorption will occur. After 2 hours, extensive external root resorption occurs. The time interval from injury until tooth replacement is a major factor in maintenance of periodontal ligament viability and subsequent root resorption. Teeth replanted within 30 minutes exhibit very little resorption, while most teeth replanted after 2 hours have extensive external root resorption. Main cause for the failure of reimplant teeth is external root resorption. Storage media. Storage media. What are the various ways to storage the traumatic tooth or easy way to remember? Stem PHC square. Stem PHC square. Stem STEM PHCC. Stem. S stands for saline and saliva, and T stands for tap water, E stands for egg white, and M stands for milk, and P stands for propolis, H stands for HBSS, that is Hank's balanced salt solution, and C stands for contact lens and coconut water. The best way to store the traumatic tooth are milk and HBSS solution and saliva. These are the 3 important one to storage the traumatic tooth. If the tooth can be replanted immediately, the proper storage can be favorable influence of periodontal ligament cell viability. Milk is the best storage media and due to the near pH of 6.5 to 6.8 and osmolality, which is a conducive for cell survival. Physiological saline and saliva are the other storage media. Important storage media: milk, HPSS, saline, saliva. Tooth socket should not be damaged by the curettage or forceful replantation. Root surface should not be scraped, dried, or manipulated with cosmetic chemicals. Splint stabilization. A splint that allows physiological movement is placed for a maximum of 2 weeks to allow the initial reattachment of periodontal ligament fibers. Treatment: closed apex EADT, that is extra alveolar dry time, is less than 60 minutes. That is, we can give reimplant and splint. Open apex EADT, that is less than 60 minutes. Reimplant, splint, no RCT, but apexification at the first sign of infected pulp. Closed apex EADT, that is extra alveolar dry time, greater than 60 minutes. Reimplant, splint, and RCT, root canal treatment. Open apex EADT, that is greater than 60 minutes, may or may not reimplant, splint, RCT, root canal treatment, and plan for implant. When the tooth is avulsed greater than 60 minutes and kept in a storage media, what are the procedures can be done for the permanent tooth? Clean the root surface with saline and then irrigate the tooth socket with saline. Gently replant the tooth. Stabilize using flexible splint for 1 week or until the mobility is minimal. Pulpal revascularization may occur, so the tooth should be monitored regularly for evidence of pulpal vitality and continued root development. For teeth in which the vitality does not return, apexification procedures are followed by the root canal treatment. For the tooth that is avulsed less than 60 minutes and kept in a storage media, what are the procedures can be done? Clean the root surface with saline. Irrigate the root socket. Gently replant the tooth. Stabilize using flexible splint for 1 week or until mobility is minimal. Root canal treatment is performed at the time of splint removal. When the tooth has been avulsed for the mouth for greater than 2 hours, the treatment of the tooth socket, the root surface, and the time required for the splint stabilization changes. Within 2 hours, 10 to 14 days after reimplantation, clean and shape the root canal and place the calcium hydroxide paste into the canals. Replace this paste every 3 months for 1 year. After 1 year, if the root resorption has reversed or stopped, the permanent gutta percha filling can be placed. The management of avulsed tooth, permanent tooth that is greater than 2 hours. Ankylosis and external root resorption will probably occur within 2 hours. Ankylosis caused by replacement gives a better prognosis than the external root resorption, which leads to failure. RCT is performed, that is, root canal treatment is performed in its entirely prior to replantation. Soak the tooth in 2.4% of fluoride solution accelerated at 5.5 pH for at least 20 minutes. The fluoride slows the resorptive process. The gentle curettage the blood clot out of the alveolar socket and irrigate with saline. Rinse the tooth with saline and reimplant it into the socket and splint it for 4 to 6 weeks. After 60 minutes, the dry storage of an avulsed tooth. Few periodontal ligament cells survive. Storage of an avulsed tooth in the tap water is as bad as dry storage. Saliva is hypotonic and thus allows the storage for up to 2 hours, but the milk has the maximum storage time of 6 hours. The teeth with complete root development should be treated endodontically as soon as possible, even if replanted within 30 minutes. The teeth with incomplete root development or reimplanted within 30 minutes may not require endodontic treatment. Now, it's a question time. What if immediate replantation not possible? Dry storage. Place the tooth in a storage media like milk or saline. Root canal treatment, RCT, or implant procedure. Answer. Place the tooth in the storage media like saline and milk, because we can maintain the periodontal ligament cells vitality. The milk has a maximum storage time for 6 hours. The saline has a maximum storage time for 2 hours. Thank you.